Well, my name is William Park. I'm a fourth year medical student at Wake Forest. I am from Fairfax, Virginia, which is in Northern Virginia, about 30 minutes outside DC. I went to William & Mary for undergrad in Williamsburg, Virginia, and I majored in chemistry with a minor in biochemistry. Sure, so I actually submitted my applications on Friday, so thank God they're out. So I am applying for Med-Peds residency, which is a combined internal medicine and pediatrics residency. It's a 4-year program where you get dual certified in both adult and pediatric medicine. From there, I'm planning on fellowship training in hematology oncology, which is cancer, bloodborne diseases. So it depends. There are 4 or 5 programs in the country that are specifically Med-Peds hematology oncology, where they focus on the adolescent, young adult age population. And those tend to be 4-year fellowships where you do 2 years of clinical training and then 2 years of scholarship, research, that kind of thing, which is pretty heavy in the hem-onc world. Pretty much every fellowship is going to do at least 1 year of research. That's 1 year longer than if you were doing just a pediatric hem-onc fellowship or an adult hem-onc fellowship where it's 3 years, usually 2 years clinical, 1 year research. Yeah, that's a great question. So I decided to come into medicine when I was pretty young. I was about 12 years old when I was diagnosed with a autoimmune blood disorder called ITP.
Okay.
Immunothrombocytopenia purpura for viewers at home. It's just a fairly benign bleeding disorder where my platelets didn't work very well. So I was in and out of a children's national hem-onc facility outside DC for several years while I was being treated for this, and kind of sparked my interest in both medicine and hem-onc more specifically. So coming into med school, I was pretty set on doing pediatrics and then fellowshipping into hem-onc to just kind of really go down that pretty narrow path. I didn't broaden to Med-Peds until the very end of my 3rd year of med school. My last rotation of 3rd year was internal medicine or adult medicine, and I loved it. So it threw my plans into disarray, and I had to start from scratch and figure out what I wanted to do. There's a lot of kind of subtle differences between pediatrics and adult medicine that you don't really see until you're on the wards doing it. And part of that's just the culture. There's this culture of wanting to get to the bottom of the puzzle, I guess. I don't know how to say that better, but in the adult world, that's often the kind of forefront of the discussion. Like, we're all detectives trying to figure out what's wrong. Whereas in pediatrics, it's usually a lot more family-centered. It's a lot more guiding this family through a difficult time. And don't get me wrong, there's a lot of that in adult medicine too. But both aspects just really appealed to me, to be able to kind of have both the more sentimental, emotional side of medicine and the analytical, problem-solving side. Not that you can't do both in either field, but
yeah.
That's just kind of the initial gestalt that I got in those fields. I also did a fair amount of work in the student-free clinic that's based out of our school. I got to take care of, one patient comes to mind specifically where I took care of him week after week. He was a very complex, sick patient with a lot of very difficult issues. And I just really enjoyed doing that kind of continuity with him. And it was an adult medicine clinic. And I don't think I could give up doing that kind of continuity of care in the adult populations if I did a pure pediatrics specialty. That's probably more than you needed, but
No, I think that was awesome.
As you know, ITP can either be acute or chronic.
Yeah.
It's something you either have for the rest of your life or it disappears. It's pretty poorly understood. It's only been recently renamed to immunothrombocytopenia purpura. It used to be idiopathic thrombocytopenia purpura.
Okay.
We know it's some kind of autoimmune thing. It's targeting the platelets. So I got IVIG treatments periodically whenever my platelets would drop too low. But for quite a while, I was just walking around with platelets in the 50s, 60s, you know, low, but not low enough to be a danger. You know, I wasn't able to do contact sports, but
Yeah.
otherwise I was pretty normal. You know, lived life normally. And then just kind of out of nowhere, my counts came up. I was probably, I don't know, 15, 16 when my counts kind of jumped up above 150, which is the lower range of normal. And as far as I know, they haven't gone down. I get them checked every year or so, just to be on the safe side and monitor, and I look for the symptoms and stuff to see if it comes back. But at this point, it seems pretty unlikely.
Awesome. Well, I'm glad to hear that, you know, you
Thanks.
remain asymptomatic.
Yeah, no, absolutely, and that's a totally valid response, of course. For me, it was the way this hem-onc clinic was run, I think. So the way it would work is I would get checked in and I would have a visit with my hem-onc doctor in a private room. But when it came to treatment, there was one big room, and it was like a semicircle of oversized blue comfy chairs. And they would have the IV set up next to it, and any kid that was currently getting treated would sit in these comfy chairs, kind of within talking range of each other while we got our treatments. You know, we'd all be wearing blankets as we got the IVs in our arms because it was cold, and sometimes they would bring in movies or they would do things to like entertain us while we were sitting there for however many hours getting treatments. But often I would just chat with the other kids, and I by far was the healthiest person in this little semicircle. I just had a very benign overall hematologic disorder, whereas a lot of these kids were dealing with various leukemias or lymphomas. And you know, it was definitely a profound kind of shift from being a bratty preteen who was upset that I couldn't play basketball anymore to realizing that, you know, the kid next to me was fighting for his life. So that shifted my whole viewpoint and kind of put me on the path towards medicine.
Nice. Man, that's really inspiring. That's pretty cool.
Yes. Short answer is yes. So I still have that drive that I've had since I was young to go into hem-onc potentially and do all this work. But as I've gone through medical school, I've realized that I've loved just so many different aspects of medicine. I don't want to shoehorn myself into one thing. So while I do have this kind of overarching plan, I'm also going into residency with the idea that maybe that won't happen. Maybe I'll fall in love with doing hospitalist medicine or something like that. And I think being open to that as you go through your medical training is super important, because there's just so many different interesting facets of medicine that you just don't see until you're actually in the hospital taking care of patients and meeting with these phenomenally intelligent peers in different fields. I also got very interested in this field of clinical bioethics through my medical school education, and that's definitely shifted kind of what kind of clinician I'm going to be. I think I eventually want to continue to take care of patients, but also have this kind of clinical bioethics background and do maybe work on like a bioethics board at a hospital. I want to be an academic physician. I want to work at a medical school, and I want to teach both clinical medicine and bioethics. All of these things are kind of running through my head as different things I want to do. I don't know if it's feasible to do all of it, but just as I go through my training, I find more and more small things that I want to add to what kind of doctor I want to be in the long term.
Nice. I think you can do it. I believe in you.
Thank you.
Either during your third or fourth year. Maybe during your third year, like the main rotation.
Sure. I'm definitely going to answer with one of the surgical specialties. I'm trying to pick which one.
Classic answer.
Yeah, it's, well, so I'm clearly a nerd, right? I'm medicine, peds, hem-onc, pathophysiology, all the way. I definitely didn't fit in necessarily in the surgical culture, I would say. And that is very site dependent. Different hospitals will have different cultures. I also just don't enjoy the OR personally. I don't like working in sterile environments like that. I don't like the kind of fear that I'm gonna contaminate something unintentionally. I became friends with the scrub techs early on because I found if you're friendly enough to them and chat with them enough, they don't get quite as mad when you mess up. Or I would probably not be here. I'm gonna go with I did a month-long rotation on surgical oncology, and I requested that because I was still thinking at the time, I pretty heavily leaning towards hem-onc of some kind in my future. And we're gonna work with these surgical oncologists as close colleagues for the rest of my life.
Yeah, for sure.
So I wanted to see what exactly they could offer, how they interact with the patients. When you have a patient that's coming in with a solid tumor, the gold standard is almost always surgery. Sometimes radiotherapy, radiation, but almost always a surgical answer. So oftentimes you kind of send them directly to the surgical oncologist. So getting to see the surgeon's approach to talking to these patients was really interesting to me. But that said, what a month. So I was on the hepatobiliary service for surgical oncology.
Does that mean Whipples?
It was Whipples.
Oh,
It was.
I've never seen a Whipple, but I've heard about the Whipples.
They are so long. So I was the only medical student on the service for that month. So I didn't have anyone to split the time with.
Oh man.
So yeah, it was. So like I remember one week I did Monday. It was a Whipple. So Whipples are very long surgeries. I think that one took like 8 or 9 hours. And then I went home. And then the next day we did a HIPEC, if you know what a HIPEC is.
Yeah.
Which can be just as long or longer than a Whipple. Sometimes depends on the extent of the disease in the abdomen. And then Wednesday was another Whipple.
Oh my God.
Thursdays was another HIPEC. It was the most brutal week I think I've ever done. Especially because I have a fairly long commute driving into the hospital.
Yeah, that sounds crazy. Yeah, you're saying 45 minutes, so...
Yeah, 45-minute drive into the hospital to get to pre-rounding by, I want to say I was supposed to be there by like 5:30, something like that.
Right,
Something like that. So I would wake up at like 4 o'clock, and I would go in and I would pre-round, and then we would round, and then we'd go do our surgery, and oh gosh, sometimes there was afternoon rounding. Surgery was hard.
Yeah.
Kudos to anyone that can go into surgery. It's just brutal hours. Well, if you can turn the camera to the right, I have my cello. I won't make you actually.
Let me turn it.
So, yeah, there it is. Woo. So I've played the cello since I was in elementary school. I don't remember when I started, probably like 10 or something like that. I've been playing the cello ever since. So I played in high school, in college. I taught some cello in college, and even now in the med school, I'm playing in a medical orchestra that's affiliated with the hospital. So just haven't stopped. I played in a quartet for a while,
nice.
Which was always fun. Weddings are a great way to make money.
Oh, have you done that?
Oh yeah.
Oh, that's sick.
Yeah,
I love people who try and do side gigs in medical school.
So wedding music is actually pretty easy, to be honest. The quartet music is not terribly hard. And the only downside is I usually have to play Pocketball's Canon, which is the worst song ever written. But yeah, so I love music. Planning on never stopping playing the cello. So hopefully wherever I wind up has a medical orchestra I can join. But if not, I'll find a community group.
Nice. That's awesome. I know it's a big question.
It's a big question,
yeah.
right? And a lot of it depends on the individual, right? So there are people who go into med school laser focused. They know what they want to do. They've never even paused to consider anything else. They want to do surgery. They want to do pediatrics, whatever. And to those, I recommend slowing down and just taking every rotation as if you were going to go into that field. Because I think you'll find that every different rotation has something that you'll enjoy. Even me, like I loved certain aspects of the surgical rotations that I was on. I don't think I could ever go into surgery, but going into each rotation with enthusiasm and trying to picture yourself doing it is, I think, super important for those people that need to kind of keep themselves from being pigeonholed into one thing. Because you might find that you want to do something else. So, I mean, I've broadened considerably from pediatric hemonc to Med-Peds, seeing everything. And then I still like hemonc, so probably still going that way. But it's definitely different than what I initially imagined. The other thing I'd say is, really take some time to think about what you want out of your life outside of medicine, and try and find a specialty that fits in with that. I want to have time to do my hobbies. I want to have time to work in an academic setting. I want to do all of these very kind of specific things that I don't know if it would be feasible to do if I was in a high intensity job like cardiothoracic surgery or something like that, where you're kind of like always on call. So I personally really like the idea of doing something medicine where I can have lots of opportunity to work in an academic setting, have a clinic day, have days where I'm working inpatient. I want the variety. So I think that taking time before you make that decision to really think about what you want outside of the actual medicine you're doing, if that makes sense. Yeah.
Well, thank you so much for being here. I appreciate you taking the time and kind of sharing your story and the specialty that you're deciding to go into. And one final bonus question is, Med-Peds in space, yes or no?
I mean, I think eventually you'll have to, right? Some of those space trips are going to be really long, right? So, cradle to grave, got to keep someone taking care of them.
You're right. And then you'll fist
punch
bump
the
the camera.
Okay.
Yeah.
Dattebayo.